Okay, let's get started. So I hope everyone can see my screen. There is a chat window or a Q&A window. If you have anything, you're facing any problems, you can just use that window. A few housekeeping will go through this presentation about how Acumatica can be used to achieve HIPAA compliance. We have a small demo of Acumatica and how HIPAA compliance is achieved using that, after which we will be having a Q&A session for any questions which you might have. A few housekeeping items is after this webinar, you will be receiving a survey question. So we would request you to complete this survey questionnaire and fill it and get back to us. It will be very helpful for us. And also there is, since this has been done in partnership with Acumatica, you will be receiving a Grubhub lunch voucher after this webinar. So be on the lookout for that voucher. So we'll get started right away. A little bit about Bista. Bista Solutions is a gold certified partner of Acumatica. So we implement Acumatica Cloud ERP for our customers. We have experience in implementing HIPAA compliant solutions for our customers. So we are present in US and Canada. We have a team of around 200 consultants working and implementing with customers like you in meeting their ERP requirements and getting them to certification and other processes. Focusing on Acumatica. Acumatica is a cloud ERP. It is one of the industry leading cloud ERP systems. You can use it to manage operations of your business. It has flexibility in deployment options, which means it can be deployed. You can use Acumatica's own cloud, or you can deploy it in public cloud, which means AWS, Google, Azure, or your own cloud, which makes it really suitable for HIPAA compliance, because as we will see, infrastructure hosting is an important aspect of achieving HIPAA compliance. A little bit on Acumatica. These are independent reviews. Acumatica is always highly rated in different reviews. This is by Nucleus Research, which has a quadrant, and it rates ERP systems based on functionality and usability. And you see Acumatica is right up there in terms of usability and functionality as well. And this is another independent survey which rates different ERP systems based on satisfaction score provided by end users. And you see Acumatica right there in the right side, really beating all other ERP systems when it comes to satisfaction score. Acumatica is a leading edge platform. There are some important aspects which makes Acumatica stand out as an ERP system. One is its growth friendly business practices. So Acumatica has a charter for customers where they guarantee that they will meet, they will give certain rights to the customers, which include a fixed percentage, capping the percentage increases for licenses, which is a big problem in the industry. It is again built on a leading edge platform, which you can use to build your own tools on top of a very strong ERP foundation. So let's jump into HIPAA. And you guys are here. Of course, it is of interest to you. HIPAA is the Health Insurance Portability and Accountability Act, and it was enacted by a federal law. So it is very important, and it's meant for protecting the information related to patient data. That is what HIPAA is about. So there are two organizations which are regulated under HIPAA, which is a covered entity, and there are business associates. So covered entity are the ones which directly deal with patient data. So these could be physicians, these could be hospitals, or companies providing services which and having to deal with patient data. So you could be providing transportation services, for instance, to patients. You know their name and other personal data. So you will be a covered entity. Business associates would be those who do business with covered entities. So it could be like a service provider like us, like Vista, which is providing software services to you. We do not necessarily have to deal with patient data, but still the law is covers us as business associates. So in a sense, HIPAA covers two aspects, privacy aspect and security aspect. So when we talk about HIPAA, it's all about PHI, is the personal health information about an individual. And HIPAA provides certain rights to the patient regarding their data, and it also guarantees or puts the onus on the providers to ensure their data is secure. And there are rules and administrative processes in protecting that data. Now, since all the software systems are electronic, it also has it involves software systems. So that's where ePHI come into the picture. It's the electronic format. So you can have paper documents containing patient data, which is PHI, but all the data in your software systems is ePHI data, and that is also covered, which is more of a focus for this webinar and for us. But essentially, HIPAA ensures that the patient's privacy is protected and it is securely handled and managed. To implement HIPAA, there are several things you need to do to implement HIPAA. There is some things you need to do at an administrative level in terms of processes in your company. And there are certain things you need to go through in terms of education and training of your staff. And there are certain requirements which needs to be met by our software systems. So in this webinar and in this talk, we are focusing on the software aspect of HIPAA compliance, right? There are several things you will need to have documented procedures in place, and the training and all of that, administrative procedures. We are not talking about that. In this webinar, we are focusing on how a software system meets the requirements for HIPAA compliance. And why compliance matters, while we get into this, of course, this is a law with teeth. There are financial penalties and other more stringent penalties for willfully, showing negligence in meeting the laws. But also, a bigger impact is to your credibility as a business. If you have violations, then irrespective of whatever, if you are a provider dealing with with patients directly or indirectly, it definitely impacts your business, which is the reason it's all the more important to ensure that you're meeting HIPAA requirements. So now, talking about HIPAA compliance at the application level. So these are enterprise applications which we are using to store your patient data for your CRM, accounting data, or inventory and other systems. We kind of divide this compliance into two parts. One is meeting the requirements at the infrastructure level, and the second is meeting it at the application level. So what does it mean, HIPAA compliance at the infrastructure level? So there are certain rules regarding security which are met at the infrastructure level. For instance, the security guidelines is to ensure that data is encrypted throughout the process. It is encrypted in transit and encrypted at rest. So we have to make sure that the data is encrypted end to end. When it reaches from the software right to your server and back, it's fully encrypted, even at storage. This includes data in your database. It can include log files where you're kind of logging internet traffic and all of that. It covers everything. So the way we meet it is we use public cloud providers, which provide infrastructure to build HIPAA compliant solutions on top of it. So we're talking in this talk, we are focusing on AWS, Google Cloud, Azure, the big ones. All of these providers have tools and platform which will help you build HIPAA compliant applications on top of it. And now if you are building using their tools and building a HIPAA compliant architecture, some of them also provide templates, ready to use templates, which you can start off with to build your infrastructure. These providers will sign a BAA agreement with you stating that, hey, if you follow our guidelines and build your enterprise application within our guidelines, it will be HIPAA compliant. So they will sign a BAA agreement with you. But mind you, it is only for the infrastructure part of it, right? It doesn't cover the other aspects. So this is one instance of how a HIPAA compliant architecture has been implemented for Acumatica. This doesn't necessarily show auto scaling and other high availability features. This is more focused on the security features of AWS and meeting it in AWS. But essentially, the idea is the entire traffic is encrypted. Remember, it should be even outside your network and within the network. So say if your application is talking to your database, it is very important that even that traffic is encrypted. Data of course, the database needs to be encrypted, and also in your log files. So you might have your internet log files. It needs to be encrypted in that as well. So this is basically end-to-end architecture for meeting HIPAA compliance in AWS. Similar to this, Microsoft Azure, Google Cloud, they provide components to meet requirements, HIPAA requirements in their cloud. Again, you need to have processes regarding key management, how your servers are accessed, how the administrative team is accessing the servers. So you need to have processes and controls around all of that. And this is an example of a HIPAA compliant architecture in Azure's cloud. And we, Vista Solutions, we are partners of Acumatica. We have experience and we have certified people, consultants who are AWS certified, who will implement it in different providers. So this is about infrastructure. Again, there are other providers who provide HIPAA compliant systems. They're smaller one, but some of them are focused only on providing HIPAA compliant infrastructure hosting. You can go with them as well, as long as they sign your BAA and they ensure that their systems are compliant. You can go with any provider, but you need to ensure that you are building in compliance with the guidelines. And you need to understand what you're doing. As I mentioned, you need to even encrypt traffic within your network. We have key management, ensure your logs, database, backups, all of them are encrypted and secured, right? Now, moving on from the infrastructure to the application level, we'll start talking about Acumatica. So what does it involve in Acumatica? Again, Acumatica has very solid security, but not all these options are turned on for all customers. Acumatica is used in a wide variety of industries. So not everyone wants to have the same level of security, but it provides these controls which you need to enable, and some of them are customizations which need to be done. But we're talking about things like auto log off. So when a user is not using the system for a while, you need to be able to configure a timeout so that the next time they come in, they have to log in. We're talking about security like password policy, expiration of password, to block a user after a certain number of unsuccessful attempt. Role-based access is huge in HIPAA compliance, because the idea is you need to limit access to data only on an as-needed basis. So basically, you have different roles. Say you're a provider, like you have physicians and you have maybe a front desk, right? So the physician might need access to entire patient data, but maybe the front desk doesn't need to know their their examination reports and other information. So you need to protect access not just to what type of data, but within the data, which data element each user needs to have access to. So you need to think about your use case and then implement it. So, but Acumatica provides these tools, which we will show you in a minute, of how you can use it. Again, you need to be able to track activity and audit. Tracking is an important piece of meeting HIPAA compliance. And we move to the next one. This is a audit trail or audit log of who accessed data. So that is very important to maintain. It's not just who changed a certain data element, but also who accessed protected health data, whether it's when was it accessed, which user accessed it, and so on. So using this, using Acumatica, we can log all audit related requirements of HIPAA. Again, we've been talking a lot about HIPAA, but similar concepts hold true for Canadian Privacy Act. I know a few companies have shown interest in that. So it's essentially, the foundational elements are the same. Security at the infrastructure level and security at the application. So with this, we will move to a demo of Acumatica and how we can implement HIPAA in Acumatica. And I will stop my screen share, and I will have our certified Acumatica consultant, Vimal, who will show us the demo. Vimal, you're there?
Hello. Yeah, Faisal.
Yeah, I mean, I can hear you, Vimal. So you can share your screen and probably walk us through Acumatica and what Acumatica is, I guess, if you can spend some time for people to see what it is, and then how we meet HIPAA requirements in Acumatica.
Sure. So like Faisal said, HIPAA is a cloud ERP. So I just need a browser and an internet to connect on. So let me log in with my user ID and password. So this is the user interface of Acumatica. And I believe most of you are not familiar with Acumatica itself. So before jumping on to the HIPAA concern, I'll talk a few minutes on Acumatica. So Acumatica is an environment that offers a multi-tenant, multi-companies, and with multiple branches system. So you can have different tenants in a same database. The advantage of having a tenant or separate tenant is that your data within one tenant is not shared by another tenant. So whatever remains in the HIPAA tenant will not be shared by the demo tenant. Those two are two separate entities with their unique data. Then under each tenant, you can have as many companies and with as many branches you would like. So right now, for example, I am having 3 different companies or 3 different hospitals in this case, with 3 different clinics or 2 different clinics in each hospital. So, but the idea of having multiple companies here is that whatever data is there in any of the companies will be shared by can be shared by all of the companies. So if there is some data, patient related data in Virginia Hospital, that can be accessed through Washington Hospital as well as Washington Hospital 02 as well, and their subsequent branches as well. Now, this can be accessed, as I told you, but only it can be accessed only if you have the access to this particular company or branch. So it doesn't mean that Acumatica offers you to access the data, but and you need to give the access to the users. You can restrict it based on the roles each user has assigned with. So you can have multiple companies and multiple branches. Then you have the relevant modules which are required by you. So here we can have receivables, payables, payrolls for your employees, services, like if your patient is coming to visiting the hospital for a routine checkup every 3 months or every 6 months, then you can have appointment. You can prefix the appointments, and system will tell you that these appointments are due, or some appointments are overdue, or the payment is pending from these patients. Once you have everything in place, then let's see, this is the dashboard we have. You can put a relevant and a proper information on your dashboard in which you are interested in. So right now, I just, for example purpose only, I created few widgets on here, which shows your patient data, your overdue appointments, and your pending payments from your patients, and as a data set which is telling you how many patients you have. So now let's talk about HIPAA. The first thing is who can access your system, or how you can restrict the user to access the system. What security features we have under Acumatica. So like Faisal said, that we can force the users to change their password every 1 month or 3 months, or every specific after every specific number of days. And we can define the length of the password. We can define the complexity of the password. Okay. Then once we have defined the password, we can we can enable the 2-factor authentication as well. And along with it, it can be the notification can be sent out in with email or SMSs. Then the next thing is how the lockout policy. Let's say a user has forgotten his password, then after 3 unsuccessful attempts, the system will automatically lock out his account. Once it is locked out, it can not be accessed, or it cannot be, he cannot reset the password after 10 minutes, or once it is locked out, he cannot key in the password again for another 15 minutes. After 15 minutes, he can key in the correct password, and then he can log in. Okay. So all these things can be managed by the administrator, whoever has the administrator role in the system. And then this is just all these settings are referred to the front end. Now, what if some guy has got an access to your database? So Acumatica does offers a certificate so that you can encrypt your database as well. Okay. So it's not just we are restricting the data on the front end or on the application. We are restricting the data or encrypting the data at the database level as well. Now, this is the all about how to whom you want to give the access to your system. Now, once you have given the access to a particular user, they can go into the system and they can play around with the different modules or different data. Now, let's say I have given access to one of my user who can see my customers, or let's say I'm having 2 sets of customers. One are my regular customers, and one are my patients only. So here I have, this is a small configuration where I have bifurcated my customer with my patients. So I have created a report which combines all my patient data all together, and it separates my other customers in a different data set. Now, once I can give this the access of this screen to a specific persons only. Let's say I'm having a huge number of employees in my hospital or in my company, and I don't want to share my patient data with them. I want to share my patient data with a specific number of users only. So I can give the access of this form or this data to a specific user. Now, once I have given the access of this data to my user, I can restrict even further to the field level as well. So I can decide whether I want to show which field to them or not. I can decide whether I want to show the address to them or to the phone number to them or their email address to them. Or I have a patient specific data in my customer patient screen. This I want to show it to them or not. Now, let's say for some of the customers or patients, I want to show this data. Some are highly classified patients that I don't want to show their data to anyone. So even though some of the users have the access to this screen or patient, they cannot see the rest of the details like you see on the first line. Even if they open it, they cannot see their name, they cannot see their address, phone number, anything. And when it comes to patient data, nothing. So you can decide to whom you want to give the access. And even if they have the access, whether you want to show the specific fields to them or not. Now, one thing is I can just make this thing as disabled or encrypted. Another thing is I can completely take out this field. So this field will become invisible for certain users. So that is another way. Now, let me just. So here, now another thing is, let's say some of the users, they came to this screen and they have modified it, some data, or they have some manipulated the data. Now, if someone has done that, we can come to this screen here, and we have this audit history log here. So we can click on here, or we can visit this page, and we can just select the screen where we want to see that who has manipulated the data. So here we can see that some of the user has came to this screen, or this particular user has came to this screen, and he has manipulated the username or any other details. Now, another case is, let's say some user have just visited the screen, or some has accessed the patient data, but they haven't manipulated anything. So we can even trace that as well, that who has access to that screen and who has logged in and checked the data, or who has visited that particular screen. So we can, this is the access history log, which tells us that how many users have accessed the system and at what date and what time, and they have seen what screen ID. So if we put a filter here, let's say, I just want to see who has seen my patient data. So I'm just filtering the data here. So here I just access the screen here. So here I can see these many users. Right now it's showing only admins because it's just a staging environment, which is showing that only admin has logged in here. So if a different user has logged in here, they can see which user has logged in at what time and on what date, and had access this customer or patient data. So these are some of the details. Then let's say, then restriction to it, like if if I want to restrict, if I have given the access to my to some of my users to my patient data, but I don't want to show them their personal detail or something. So we can come to this restrict personal data screen, which is a GDPR detail, and we can just filter out the business account, which are nothing but my customers and vendors. So in this case, I'll just filter out someone, start with P00. So all of these are my customers or patients. So let's say I just restrict or this data P008. Okay, it's processed now. Now if I go here and just I so if I open this P008, this patient, now everything has been encrypted here. User cannot see, though I have access to this patient, I cannot see this details here, address details, phone numbers, anything, or even if I cannot see the patient data from here. Now, let's say I have another set of users whom I don't want to give the access this patient data. I just want to show them this customer data only, other customers who are not my patients. So I am right now I'm logged in with my admin. So if I change the user, and let's say I logged in with Dinesh, and now I can see only limited set of modules here. And if I go under my receivables, I can see only customers. I cannot see the patient menu here. But if the same thing, if I go under from admin user, I can see the patient menu also over here. Now let's say from Dinesh login, I go to customer and open, let's say, one of my customer. So here you can see all the details are here, but one of the tab which was over here called patient data, this tab went missing from Dinesh login. This is so you can control the tabs, you can control the fields, you can control the modules, you can control the screens based on the user login. So Acumatica does offers that kind of restrictions to the users, that whether a user has access to a particular hospital or branches over here. Once they have access to the particular branches, whether they can access a particular module or not. Let's say they can access a particular module as well. Then whether they can have access to a particular sub menu. Let's say they have access to the sub menu also. Then whether they can access, let's say they have access to this patient menu, then what data they can see here. Let's say they can see all of the patient data here, their name, whether it is patient or not, whether it is insured, what is the insurance company, policy number, all those things. We can restrict those fields. We can restrict them, or we can make them invisible, or in other words, we can make it hide. We can hide it from the users. So I think that is something from the HIPAA point of view. And let me just quickly show you one small entry also. Let's say one of the patient has visited the hospital and you want to, so first of all, let's say he's not in our database. So it's a new patient here. So we can directly create a new patient from the dashboard. So let's say his name is Paul, and I don't know other details. maybe not even his phone number, or let's say just key in some random phone number, and other details or patient specific details I don't know yet. He's a new patient, he just visited the hospital. So once he has, let's say he visited for the full body checkup. So we have created a patient by just entering a name. All other things are pre-filled by the system. So by the time when I come to know about his other details, we can fill in the details. But right now, let's say we have a patient here, and now we need to bill him for his full body checkup. So we can just open a screen for our cash sales or just a counter sales, and then we can select our patient, and then we can select, let's say, checkup, body checkup, and that's it. So once you release this entry, system will pass the relevant journals or will post into the relevant accounts. And then once you have created the entry, you can even get it printed from the system, and you can give it to your patient, or you can send it via email if you have the email address. So this comes out of the box with Acumatica. So once everything is in place, you can release this entry. So that's it. It's very quick and very handy. You can do these things on the go from the mobile app as well. So yeah, I guess this is all from my side. Over to you, Faisal.
Okay. Thank you, Vimal. And thank you. So this was, and let me quickly share my screen. So this was a quick demo for about how we can meet HIPAA compliance requirements in Acumatica. So just to recap, Acumatica is a full-blown ERP solution. We showed you aspects of HIPAA compliance, but it includes various modules. It has integrated modules for CRM, managing your patient data. It has inventory management. So if you are a medical device manufacturing company, you can do your inventory. You can actually even do your manufacturing process within Acumatica. It is an accounting system integrated within Acumatica. So you can do your complete books, your financial reporting, everything from one system. So Acumatica is a complete ERP system. It can be accessed anytime, anywhere from any device, which is really handy. Um, and we can move to questions now. So we have a Q&A box. I believe you can just type your questions in there. And we already have a couple of questions. By the way, on my screen, you can see our contact details. Feel free to reach out to us if you have any questions regarding your requirements. You're wondering how to implement HIPAA within your organization. Just feel free to reach out to us and we can help you out, because as you see, there are these tools and available within Acumatica and within the cloud providers, but you need to work with a solution provider who understands what is the requirement for HIPAA, and it is different for different companies. If you are a medical device manufacturing company, you have certain different requirements. If you are a healthcare provider or you provide services to hospitals or other companies, each one has a different requirement, and we as consultants, we understand what is needed. So feel free to reach out to us and we can help you out. We have a couple of questions. One is, how long does it take to implement HIPAA compliant ERP? Uh, so the answer, it really depends. Really depends on your business, what you are doing. For instance, we work with medical device a startup which makes devices for people who've gone through orthopedic surgeries. Um, so it took us maybe around 4 months to implement an ERP system for them, a HIPAA compliant ERP. Of course, it was a very fast-paced implementation. They had all their teams completely involved with us during this process. They were a startup, a well-funded startup, so we were able to work with them and implement HIPAA compliance for their requirements. So it really depends what your business model is, where are the touch points related to patient data, and a number of different parameters are required to implement an HIPAA compliant ERP system in a company. I have another question. It says, how does the software protect customers' data and help follow the HIPAA compliance requirement? So as we saw, it's at multiple levels. You have to protect data at multiple levels. We talked about infrastructure level, protecting and encrypting data. Vimal showed you an option in Acumatica where you can essentially encrypt your database, which means, say your backup, right? So your backup is lost or someone gets access to your backup, they will still not be able to access the patient data because it is encrypted. So it is at several levels, including encryption, including protecting access, some of the things which Vimal showed in his demo of how you can protect and restrict access to different users, and of course the audit logging and other aspects also are involved. So all these pieces come together, and that's how you implement and protect your customers' data. So I guess, let's see if there are any more questions. Feel free to type in the chat box. There's another question, which is this compliant with bring your own device? So of course, people are working virtually, and bring your own device is common. It depends. Again, there are certain tools, controls you need to implement in your network, right? For this to work. So we are talking, yes, the application can be accessed from any device, but we'll have to look at your use case. You might have to set up a VPN network to ensure there is encryption end-to-end. It's not susceptible to man-in-the-middle attack and other things, though you see everything was encrypted, but still it really depends. We'll need to see your use case, but Acumatica can be accessed from any device. It could be accessed from a computer, from a mobile phone. There are actually applications, apps available to do warehousing on your phone or a handheld with Acumatica. So there are tools available. We'll need to talk about your use case. So we are almost at the end of our 45 minutes for the webinar. So if any one of you has any questions, feel free to reach out to us. We will send you a short survey. It would be really great to hear from you. And thank you so much, everyone. Thank you for attending.